Ma'am, 30க்கு ஸ்டார்ட் செய்யணும் பாருங்க.
Mini, then who will on the recording? How will?
Recording I will on.
Okay.
Ma'am, just 1 second.
Mini, can we start or we have to wait?
Father already said we have to start at 4:30 now.
Ma'am, but just confirm the YouTube also.
What to do?
Okay, ma'am. Manju, ma'am.
Okay. Lincy?
Yes.
Okay, Lincy. Lindsay, so happy to see you again. And we are so happy today you are taking section for new batch. Yeah, we are eagerly waiting for your class. Thank you, Lindsay.
Thank you, Manjuchechi, for the invitation. Yeah, okay. So, good evening, all. I'm Lincy T. Jose, and I thank God, Father Salim Joseph, and all the admin panel members for providing me this wonderful opportunity. And especially, I thank Minnie for providing me the help to take this class. So, before starting the class, I would just like to tell a few words. Like how I came into this platform. Like as I think many would have been practicing OET since many months or many years, and some would have already attempted also, I believe. So as my opinion or what was my experience was that even I have practiced OET outside this platform, and literally I was thinking like this is not my cup of tea. But once after coming to this EduSkills, and it was a God's like God's will that I just came to some of my I heard about this platform through one of my friend, and we both came together. And once we entered, like we came into EduSkills, we actually knew that what is OET. And the first and foremost thing was that we got the confidence. Yes, even I can crack OET. That confidence is more important. So once you have that confidence, so I saw like many were messaging, I love OET. Yeah, that should be I love. You should have a love feeling to whatever you do. Not only OET, whichever work you do, you have to do with your wholehearted. Then it will become a success. So the same thing, you when you have to study OET, you should not feel like burden. Like how can I complete this task, or is it possible? Everything is possible for everyone, as you tell. If you have, if there is a will, there is a way. So if you have that will in your mind, and you can do it. So have that confidence, and the thing is like you have to follow. If you are one advice what I have to like I would like to give is that if you are following EduSkills, and if you are following the father strategy, please stick on to that. Don't be like what do you tell, like you keep leg in both the boats, so you'll be falling in between, so you get confused. when you just want to listen to so many other people's classes and everything, whichever it is, if you are feeling with okay with the other class, you go with that. That's okay, no, not an issue. But you have to follow one strategy so that you will never get confused. But 100% I'm telling, if you follow father strategies, you will crack OET in the first attempt. And the thing is, like, you have to practice. There are so many activities been going on in our EduSkill platform. So when I was an active member there, we had this daily discussions. We used to take classes and all. So as everyone, like as a new student, we were like, the doubt was like, we have come to learn here and they are making us to take the class. What is going on here? That's what the first and foremost feeling what we had. But as you like days passed by, we understood what is the importance of taking class. Because if I know, like, as we all are nurses, we'll be teaching, like many will be senior staffs, and you will be teaching your juniors. So if you know something, then only you'll be able to teach your juniors. If you don't know anything, you can't teach. So it's the same thing is being applied here also. So when you want to take class to your batch or something, you will go deep into that. So automatically you are learning it more. Okay, so that will make you more make you understand about the OET questions and whatever the whichever part, whichever module what you're taking class or something, or any one, at least one question. If you're doing, when we were doing, it was like one question, one person. So we used to go into that particular, according to father strategies, you have each question has different, for example, if it is a part B, it can be a different types of questions. So when you are teaching a particular question, so whenever any other you take another material and you find the same type of question, it will be very easy to find the answer because you already know the trick or the strategy how to find out the answer. So it's like, try to teach among yourself, take class. We used to do that. And yeah, consistency, like you have to be regular, and it's not like you have to spend the whole day with one, but you have to sit with one the whole reading or listening. Because I have attended another course in some other institution, not by physical but online, not offline. So when they used to just tell us, the first and foremost thing they used to tell us is, each day you have to practice all 4 modules. And it was like so hectic. You have to sit such for 4 hours, and that's not possible. As a human being, and we are working women, and we have so many other things. We have to look into our professional life, our personal life, our family life. Everything is there, and that's not possible. And it was, if at all we used to try that trick also, it is like you just can't complete it. But when I came to EduSkills, father was like, you practice only one question, that's more than enough for a day. But next day you have to practice the other, but you have to be consistent in your practice. Okay, so slow and steady wins the race. So according to father, it is like you have to spend at least 4 to 6 months. So as when we had practice, we used to have like 1 month full reading, A part, B part, C part, and the last week we had the whole mock test. So 1 month was fully for reading. The next month we used to move on to listening. So every month we used to complete each module, and at last the 5th month we used to have like all mock tests in like exam type models. Like we had full everything, reading, listening, speaking, and writing. So by then we were like, okay, 5 or 6 months, that was minimum. That's what I feel. For me it was like, okay, for 5 to 6 months I was okay with that. Then I thought, okay, I'll write the exam, but still I took time, and then only I wrote it. But I followed father strategies, and all the videos what you have, like everything has been uploaded. And this class also what I'm taking is, it's nothing new, because it's been taken by so many people. And main thing, one more thing I have to tell is, practice only the official material. You go into the, it is available in our platform. And also, if you can just open the OET website, you get the official. You have to open the official website and get the materials. And I think some 5 materials are available. So you can just practice that 5 materials itself, and that is more than enough. It is like a more. What do you tell? Like you practice. It's like a max solution, max problems. So practice the OET official material with the further strategies. So strategies are like formulas for your max problems. So you know the formula. It's so easy to you solve the max problem. So you have to follow the strategies and apply the strategy. 99% of strategies can be applied to the almost all the questions. Okay, so you can clear 99% of the paper can be cleared with the further strategies, and just 1% it will be like something different. Otherwise, 99%, if you follow if you are following strategies, it's very easy to answer your OET. And that's what I told. Don't get confused with any other some other materials. Like you get even that's what it was my experience. I used to literally had some n number of materials. We got it xeroxed, all print out everything. It's been almost I just wasted my money. And it when we read that, it will be like, oh my god, I can never crack OET because it's not according to the official material. They just want to make you confused and get you stressed and all those things. People will be like, and answers everything, you will never find. You can't. And if you try to apply the strategies, you can try also. If you're thorough with further strategies, you try with the strategies, that those materials, you'll never find the answer because that is not authentic. So please only practice authentic material. Though it is only 5, sometimes you may feel like it is repeated. I know the answer already, so I can write the answer immediately, especially for part A and all. But it's okay that you just practice, you know the way. That's what I told. It's like a max problem. So you know the formula. You practice it. The same thing you practice, but that formula will be in your head. Okay, this is the way I'm getting the answer. So part B or part C, this is the way I'm getting. You know the way how you're finding out the answer. That should be in your mind. It's not about the answer what you're getting. It's the way. How did you get at last? How did you get the answer correct? Say, for example, part B or part C, you feel like all the answers are the same sometimes. So according to other strategies, you start applying it, then you can find, okay, so this is not the answer. So main thing is you have to eliminate all these answers. At least what is the correct answer? That will be the answer. So for that, you have to practice with the strategies and practice only with the authentic materials. Don't get confused with so many other if you are following any other people's sounds. I'm not blaming you because you just get confused with that. You can just better follow any one, whichever you feel comfortable. For me, this EduSkill platform and father strategies, it was like 100% comfortable for me. And that helped me to crack OET in the first attempt. So I think this is more than enough. It was just a small introduction. And I think I will move on to the topic. Okay. So I would request Minnie to share the screen, Minnie.
Is it visible as?
Mm.
Yes, yes.
Yes, sister, it's visible.
Okay. So yeah, I'll start. Once again, welcome all. And as you know, we are discussing reading part B today. And let's start with a small introduction. So as now we can see in the screen, what is the expected grade or band or a numerical score? So
Grade
anyone can answer?
450 to
Grade
500.
Pardon?
450 to
450
500.
Yes,
450
yes,
to
500.
500 grade
yes,
A.
yes, that's good. Yes. So according to fathers, opinion, or what he stresses on as like everyone should aim for an A grade, that is around 450 to 500. So once you aim for A, at least you will get B. Okay, you should not feel like, oh, I need only B for UK or something else. You should not settle with that, because sometimes it may become like C plus or C. So always aim for A. Okay, next. Okay, so now you have this transition from OET reading part A to OET reading part B. You know how you will write, reading part A. So that reading part A, as you all know, it's only for 15 minutes, and you will be like, you will be in very rush, and your mind also will be like rushing to find out the answer within this 15 minutes or 12 minutes, whatever it is. So your mind will be fully rushing, and it will be going in a very fast track mode. So once you have completed your part A, they are going to collect your answer booklet, and then they'll give you the reading part B and C booklet. So that time, that period of time, you have to consciously pacify down your brain, and you have to make yourself calm and quiet, because you were just your mind is like fully disturbed. So just make yourself calm, and take deep breath and make yourself down gradually. Okay, and prepare for part B. Yeah, next. So now next is like 5 easy steps to speed up during reading part B. So this speed up is during the reading part B. Okay, so slowly you will be prepared. You will get the booklet for part B and part C, and you'll start. So once as you get the booklet, you have to read the content, and it will be like, first you have to the main what they are finding to assess in this reading part B is they are going to test your ability to quickly understand the gist or main idea of the short text. So it is a short text. It is a separate, you have one question, and then you have the answer options, and you have the paragraph. So they are just testing your ability. So how good you are to get understand the gist or the main idea of the short text. And also select sorry okay, and you have to select the you have the 3 options. So from that you have to take the best matches, whichever the option is best matches, because sometimes you feel like all the 3 answers are correct. Okay, so which is the best one, that you have to select. So for that, what you have to do, the 5 steps. So first is the read the context sentence, which gives you the information about the text types. So I'll tell you what is a context text sentence once I start with the examples. Okay, then read the question statement. So first you have to read the question, then read the answer options, then go to the text, read the text, and choose the best matching answer. Okay, next. Okay, so you have the documents. You get the extract from some of the documents being used in a healthcare department. So that can be any policies that we are being followed in a hospital, or work emails, then any instructions given, or guidelines. Guidelines are like the way any procedures or anything that if healthcare personnel have to follow, and any manuals like maybe how a machine works, maybe for us BP apparatus or glucometer, some manuals will be there. So any one paragraph from each of these will be given with the question and answer options. Okay, so each thing, each reading part A, B, and C, we follow a different method. So in reading part B, we follow the QAT method. That is, you are reading the first, you will be reading the question first, then you read the answer options, then read the text. So that is called the QAT method. So in QAT method, after reading the question and answer options, you go to the text. And while reading the text, you have to first look for the nature of the text. So nature, as I told, you have to see whether it was a, whether it is a policy, whether it's a work email, instructions or guidelines or manuals. Okay, so that is the nature of the text. Okay, next you have to identify the paragraph structure. What is the paragraph structure? Like you have the topic sentence. So you have the topic sentence, how it is being structured, where when you have different types of paragraph structures. You can be like cause and effect language. There will be some cost and you have some effects based on that, or you have some problem and solutions. So what is the, you have to identify the paragraph structure. Then focus of the text. What is it talking about? What is the focus of the text? Whether if it, for example, if it is a manual, it will be talking about how a machine works. So this is maybe, it is not like a full content, maybe one part. So maybe like glucometer. What is the uses of glucometer? Where in whichever conditions you can use the glucometer. Only the uses. It may be the uses. The focus of the text will be the uses of glucometer, for example. Okay. So that you should be thorough with that. Okay. Yeah. So again, the same thing what I told is like in this part B, the skills, our skills, what they are assessing. They are assessing our ability to identify the detail of the text or the gist or main point of the text. What is the gist means? The main point, the overall, the summary of the text. And also to ability to identify specific ideas at sentence level. Sometimes, see, these answers are, you have like different types of questions. It's like gist based question. Gist based question in the sense you have to read the whole paragraph to find out answer. It's like a summary. Sometimes it will be like identify specific ideas at a sentence level. You get the topic sentence, the answer will be there. Or sometimes like you have the contrast based question. So after the contrast word, you get the answer. Okay, so all these things. So these skills have been assessed in the part B. So yeah. So coming to the part B, nature. So what are the usual, how it is there? It is like you will have 6 questions, and it's almost equivalent to 6 marks. You will have 6 short text from different healthcare workplace, and it is about 100 to 150 words each. The same thing what I told, the text will be from policy documents, hospital guidelines, the manuals, or internal communications like emails or memos. And you have 6 MCQs, I mean 6 questions with 3 options, and approximate time or maximum time for part B is 12 minutes. And method we are following is QAT method. That is, you'll be reading the question, then answer, then you will read the text. Yeah. So how to select the correct answer? So once as you get the, as you read the question, as I told you, we are following the QAT method according to FATHER strategy. So after reading the questions, you will be reading the options. So in that options, you can direct even before reading the text, you can just have an idea of the answer. So eliminate the absolute. What do you mean by absolute? It's like an extreme. So absolute is like everything, everyone, or all. It's like it's not possible. For example, all nurses work in the hospital. No, you can't tell all nurses work in the hospital, because people work in colleges, people work in companies, or all those. So that all nurses work in one place, that is an absolute. So that can never be the correct answer. Then eliminate the wrong ones. Wrong ones in the sense, once you read, you feel like something is like, once you read itself, you feel like the sentence is wrong, something like that, you can just eliminate it. Then look for precise language. Precise language is like more grammatical language, correct. Okay, the grammatically correct and more professional and correct answers. Like as we are professionals, some answers like we'll be able to judge before reading the text according to the questions. We can also just have a guess on that. Okay, so straight opposite. So some options will be there like straight opposites. One option will be like positive, one option will be the just opposite, like negative answer. So in that, if it is there, then one of them is the correct answer. Okay, then radical answers. Radicals is beyond boundaries. So radical, like very unimaginable, something we just it's like an imaginary thing, something they have written. Then it is like incorrect answer. Then educated guess, as I told, like use your logic and your knowledge, and you can just have a guess. Okay, this can be the answer. Okay, it's the same thing like random guess also. Next. Yeah. So once you get the question, you have to focus on the heading or the topic sentence to understand the gist or main idea in the paragraph. So while reading, after reading the answer options, you will be moving on to the text. So once you read the text, first you have to focus on the heading or the topic sentence, the first sentence, to understand the gist or main idea of the paragraph. So once you see the top heading or the topic sentence, the first main sentence, you will know, okay, what they are going to tell in this, what will be followed after this topic sentence, what they are going to tell in this paragraph. So you will understand once you understand the heading and topic sentence. Okay. Yeah. So focus on strategies, signpost and clues. So to find the answer, what are the things you have to focus on? The main thing you have to focus on is paragraph structure. What is the structure of the paragraph? As I told you, it can be a just plain one topic sentence and supporting sentence and all those things. Otherwise, it can be a problem. There is a problem for that. The first sentence will be a problem. Then you have followed by the solutions. So you have to focus on the paragraph structure. Next, focus on the topic sentence. So topic sentence. So you know the once you focus on the topic sentence, you get the summary or the gist or the main idea of the topic. Then next is ignore the subject complements. What do you mean by subject complements? It is a main, there is a subject and something is describing in a bracket. Okay, you can just ignore it. Nothing, the answer will never be in that. So you can just ignore that. So it will save your time. Then look for opinions after the contrast word. So always look for the contrast word. So usually the answer in the contrast, usually in answer means the contrast based questions. If it is a contrast based questions, you get the answer after the contrast word. Okay. Then focus on scale expressions. So what do you mean by scale expressions? Anybody?
It is almost many.
Yes, good. So scale expressions is like you have the scaling, okay, like higher to lower or lower to higher, or almost, many, all these things are scale expressions. So you have to focus on the scale expressions. Usually you'll get the answer next to that in that sentence. Okay, then you have to look for hedging words on the question statement. So in the question statement, you have a hedging words like the main word. So based on that, you have to find the answer in the text. Okay. Next, look for synonyms. Synonyms in the question, they'll be for example, in the question, it can be given as healthcare health assistant or something like that. In the text, you may find a carer or something. So it is like a synonyms and synonymous language. Then look for paraphrasing. Paraphrasing also, it can be like you understand. When you see in the text, it can be like make it clear. So that is a paraphrasing. Okay, so you can look for all those things. So that would be your answer. Then look for modal verbs. So what are the modal verbs? It's like could and yeah, may, like you have that no, like what is the modal verbs is like may, could, and should, all those
They
things,
might get.
so that you get the answer some close to that. And one more is cause and effect language. As I told, in some paragraph will be like cause and effect language. If there is a cause, then what is the effect of that? Something, there is a cause. So what is the effect? So that will be the maybe the cause is the question, the effect will be the answer. So that is a cause and effect language. Next. Okay, so this is again the same thing what I explained. Like it's a workplace short workplace extracts, and it's about MCQ questions with 3 options, and you have to have the general understanding of the text, that the skill is being assessed. What is the skill being assessed? What general understanding you have of the text, okay, and what type of document it is, and what is it used for, the information is it trying to get across. So type of documents in the sense whether it is a manual, whether it is a an email, or something like that. Then what is it used for, whether you're giving some, for example, guidelines is given instructions to a healthcare personnel, and what information is trying to get across. Then synonyms and synonymous used in the question, and understand the general meaning of the text. Okay, this again the same thing. Next. Yeah. So now we'll just move on to the exam. Like we'll just try to solve the one of the part B sessions questions. So this is from our official OET. What is that? Content material. This is a part B of management of diabetic foot ulcer. There is a part A, and we are taking the part B from that particular material. Okay. Can we start?
Yes, me.
Yes. Yes, ma'am.
Yes,
Okay.
please.
Yeah. Slide.
Lindsay, just wait. Maybe she has some issues. Just
Mhm.
wait for a few minutes. If any aspirants want to ask anything, you can ask Lini, okay?
Manju ma'am, excuse me.
Nitya?
Power has gone to mini. Then what we will do for sharing? Lincy ma'am can share that screen.
Oh.
I am not in lab.
Actually, I entered through mobile. I don't have laptop.
Mm.
Action is
What we
not
will
there.
do?
Father.
He is in
Father.
some meeting, and he will comes in between that. Before finishing time, he will come. It on like that. Is anyone?
Imani also is not there. Otherwise, you
Many
can.
is not present today. Then what we will do, ma'am?
Anybody is using laptop?
In this class, anyone is using laptop?
Yes, sister. I'm using.
And
But
Hero?
still, actually, father has to make her to host, or we can make her to host.
Okay. Okay, that's the problem. Then
Nitya, wait. Just I will try to call father.
Manju ma'am, Lincy ma'am.
Yeah.
Okay, Himani will join shortly. Can you teach some strategies or anything in between that? Within 5 minutes, she will be there. Himani will be there, and she will share the screen also.
Okay.
Okay.
Anybody, like, can they have any doubt? Like,
Okay, please ask. Please, you can discuss anything with ma'am. You can ask any doubt with ma'am. In between that, we have 5 minutes time.
Ma'am, good evening.
good evening.
I'm Jyoti. I
Hi,
wanted
Jyoti.
to ask if hi ma'am.
Jyoti, a second.
Echo avuna?
Yeah. You just reduce your volume that second instrument.
Hello.
Hello.
Jyoti, still
Yes, ma'am.
Still echo.
Second device may be on, that's why.
Hello, ma'am.
Yes, tell me.
Yeah, I wanted to know how we can improve part B and how to know that this paragraph is a memo or manual or just based answer. So it's very difficult to differentiate, ma'am. How can you find that?
Yeah. The main thing, like, what? Echo avunale?
Yes, Lincy, some echo issues there.
What
I
happened?
think everybody is having same issue. When you are speaking, also same thing
Yeah.
happen.
Something is here. Any problem?
Here, no problem, sister.
It's better now.
Yeah, now it's
Yes.
Yeah.
okay.
I
Yeah,
can
it's
talk.
better now.
Yes, Jyoti, you asked something about, like, how do you find out the types of questions? Is that?
Yes, ma'am. Yeah. Yes.
Okay. Can you just repeat it? Now I think it's clear. Repeat the question. Hi, Jyoti.
Okay, I wanted to ask, if the paragraph is gist based or memorandum or guidelines, so there are different types of paragraphs. So how can we improve in that? How can we differentiate and how can we find out whether
Yeah.
it is a guideline, memorandum, or
No,
like
that
that?
is
How can we
no.
gist
Just
based?
you got confused. Types of documents. What I told was types of documents. That is the extract. What this question, this passage, what they are giving us. That will be from policy. It can be any policy, or it can be from any work emails, or instructions, or guidelines, or manuals. That depends on that. Like, once you read that, they'll be given. I mean, it will be given in the question itself. It is an extract from the manual. For example, the first question is like extract from the manual on the surgery. So it is from the manual. What I told about GIST is that is different. Like, types of questions, GIST based questions, contrast word based questions, and the question will be like that. You understand the difference? What I'm telling?
Yes.
Documents is different from where you get the question, from where people, I mean, OET is giving us the paragraph. That paragraph, one paragraph, for example, it will be a one paragraph. That paragraph is being given from this, any of the policies. Each hospital will have a policy. Even if working in corporate
Yes.
hospitals and all, you'll have a different policy for each thing. So any one of that one paragraph from that particular policy, they'll give. So maybe, for example, as I'm working in OT, I can tell like cleaning of an OT after each procedure. They have one policy. Okay, so from that one paragraph they'll give. So they'll give they'll give a subheading as this is the extract from the policy from operation theater. So you know that whether it is a policy or whether it's a guidelines given to a health a dentist or guidelines given to a pharmacist. So you will understand. The gist, what I told is like gist means the main idea of that paragraph. You understood?
Yeah.
So question will be like gist based, I mean main idea based or topic sentence based, or depends on the synonymous language based or contrast based. So different types of questions. So that's what I'm telling you, have to practice. You keep on practice. I mean, practicing means just not blindly. You have to first follow father's all videos and make notes. I used to do the same thing. I have made the notes. So you have, whatever you're listening, you have to take down and you have to practice according to his strategies. So as you try to solve each questions, you will know the answer. Okay, this is the way for this question. This is the way you have to answer. Understood. So once you get that idea, that idea has to come, like it's come after, like you are doing practicing according to father strategies. You get the idea, then you apply this idea to the material what you are getting. Understood?
Yes, ma'am. And I have one more question, ma'am.
Yes.
In inference-based question, like answer, inference will be the conclusion sentence, right? So in that there is a deduction method and induction method. So can you please explain that if you can?
Suddenly you're asking. Sorry, now I'm not getting that. I forgot. Inference. I can try, but not now.
Inference type question,
Okay.
most of the time we will get answer at the end only. Most of
inference
time
is that only, but she told some induction and something.
induction I am
Yes,
also not
induction.
sure.
Yeah.
Two types is there. And
Deduction
the father
and
told
induction method, the father has told in that there are two types in inference based answer.
Inference.
Yeah,
Okay.
B part. So the answer is at the conclusion, that I understood. But I want to know what is that induction and deduction method. So father had mentioned that. So if it is possible.
Okay, then we will just remain father to
Later.
explain
Yeah.
about that.
Okay.
I think Jyoti,
Yeah.
father will take
Yeah,
one by
Jyoti,
one, like
just
all the types of question father will take.
the
So
12 to 1
Okay.
one is Mendes hours is there. That time you can raise that question. Okay. No worries.
Okay, ma'am.
Thank you.
Thank you. Thank you, ma'am.
Okay. Is it okay now? This one. Ready?
Yes,
Yes, ma'am.
Lincy, Himani.
yeah, I can share whenever you want.
Lincy, Himani is there.
Yeah.
She can share.
She has the material, or should
Yeah, I have it.
I? Okay. Can go directly to the question. Question number 1, part B. Yeah. Okay. I'm audible, right?
Yes.
Yes, Lincy.
Yes, ma'am.
Okay. Okay, we'll start with the first question. So we are following the QAT method. So you will first read the question, then answer option, then we'll be going to the text. So question, when disclosing distressing information to patients, staff must avoid. Options: the temptation to use simplistic language. B. Directing their attention at family members. C. Any approach which leads to misunderstandings. Okay, so once after you read the question, you will be like, you can just have a thought in your mind. Okay, this is the question. When disclosing distressing information to patients, staff must avoid. What should we avoid? You can have in your mind. Then the temptation to use simplistic language, directing their attention at family members, or any approach which leads to misunderstandings. Okay, you can just have a guess in your mind. Now we can go to the text. So that is it. Extract from a manual on surgery. So this is they're talking about some surgery, the manual. What are the procedures to be followed during or after or before the surgery? So disclosure. What do you mean by disclosure? It's a making something known. You're going to tell someone about something which they don't know. Okay. Okay. The delivery of bad news is very difficult. Arrange to talk to the patient in the company of family, preferably away from other patients. In some cultures, it's not common to give difficult news directly to the patient. We must be aware that the norms and customs of our patients may not match our own. Often, we try to soften the delivery of bad news by saying too much and confusing the matter, or by saying too little and leaving people with unanswered questions. Don't say neoplasm if what you mean and what will be understood is cancer. Be clear. Allow people to understand and feel some of the impact of the news, and then allow them to ask questions. It is often necessary to repeat the information to other family members or to the same people the next day. Okay, so we'll just move on to the this one. So here you can see what are the words I have highlighted in the question. Disclosing
Disclosing distressing information.
distressing information.
Information and staff
Okay.
must avoid.
Staff must avoid. So when you are going to disclose some distressing information, okay, distressing information is like not that good good. No, it's not that good information. So when you're telling something information which is not that good to a patient, what the staff must avoid? What should we avoid? Or the staff? Okay. Now in the answer options, what have I like the hedging like main words, keywords?
Use simplistic language, first one. Second, attention about family members, misunderstandings.
Yeah. So here you can just think like what the staff must avoid, whether the staff must avoid to use a simplistic language or to avoid attention at family members or avoid any misunderstandings. Okay. So now itself, so I think some many people would have been getting the answer. Okay. Usually it is like general, like we know as nurse when we are, we know how we will be telling the patient if something is wrong. Okay. So that automatically will come into your mind. So there itself, we can find out the answer. So now, once you go to, I mean, again, read the text, what will be that? The first sentence, what has been written? The delivery of
The delivery of bad news is very
bad
difficult.
news is very difficult. See, here you can see a paraphrasing of the word. That is, in the question, they've given distressing information, whereas in the text, it is given bad news. So that is called paraphrasing. Okay. Then next, arrange to talk to the patient in company of family, preferably away from other patients. Okay. So when you see the, now already I've read this one. I'll just discuss the answer. So first one is the temptation to use simplistic language. So what is the staff must do? So must, you know, what is that must?
Must use simple language.
Must is a
Must use.
They should do.
Model verb.
They need to do.
model
Model
verb.
verb.
Model verb.
Model
You have to avoid. Must avoid. Avoid. I mean, must avoid. It is a necessary. Okay, what should they avoid? Whether to use simplistic language?
No.
No.
No, they
So
should
it's
use
wrong.
simple language.
They should use simplistic
Simple
language. You can read, you can don't say neoplasm if what you mean and will be understood is cancer. So that is when you have to use simple language only. Then only they will understand. Next, option B, directing their attention at family members. Whether we should avoid, it is like avoid. Staff
No.
must
No.
avoid directing their attention at family members. That means you should not tell anything to the family members. You should not give any attention. Is that so?
No.
No.
We have to
No.
avoid.
Arrange to talk to the patient in the company of the family. So with the family only you're talking to the patient. And last sentence also it gives a supporting. It is often necessary to repeat the information to other family members or to same people the next day. So you're including the family members also. Okay. So third option, any approach leads to
Which leads to
misunderstanding.
Misunderstandings.
So anybody, like, where is the answer?
C.
C. That is the answer.
So that is the answer. So how do you get? You have to always give. Where is the answer? So here you can see. Often we try to soften the delivery of bad news by saying too much and confusing the matter, or by saying too little and leaving people with unanswered questions. Okay. So don't say neoplasm if what you mean and what will be understood is cancer. Next is be clear, allow people to understand and feel some of the impact of the news, and then allow them to ask questions. So this is the way. See, like, be clear. So avoid misunderstandings is to, what is the staff must avoid misunderstanding means be clear. Avoid misunderstanding is obviously paraphrased as be clear and allow people to understand and ask questions. Okay, so these all things that should be avoided. What should be avoided? Anything which is becoming misunderstanding should be avoided, like using unnecessary medical jargons and talking too many things and all those things. You should make them understand very clear and as make the people to ask questions also. So everything is clear. Understood?
Yes.
Yes.
So how you got the answer?
Yes, ma'am.
That's-
Ma'am, one doubt.
So ma'am,
It
this
is any, it is coming, no? It is any approach means there is a absolute is there. Any? No.
Yeah. Must avoid the that's what. See, staff must avoid any approach which leads to misunderstanding. See, one more thing I can tell. That's what I started. I told in the beginning of the class itself. It is 99%. So that 1% is there for everything. It's different. Okay. So here this absolute is different. Okay. Any approach which leads to misunderstanding. So this is based on the text only they're telling. Okay. So that's why. So here you can like actually when you read this question and option itself, almost I think you will get the answer. So it depends that 99% or that 1% will be there for different questions. So you have to apply also that absolute or synonyms or even modal verbs also. You get so many modal verbs in one paragraph, but it's not like every answer is after that modal verb. So you have to read the sentence, everything all together, then you will get the answer. Okay.
Excuse me, ma'am. Just a quick question. As Father told us about the type of the questions yesterday's videos. So what is the type of this question?
This one.
Yeah, this one. What is the type of this question?
This is what do you this is actually a gist based question. You understand totally. Okay. And top. Hello. First, you can also know once you read the topic sentence, that is delivery of bad news is very difficult. Okay, so first they're talking of the topic sentence. What they've given is about the bad news, and based on that they are telling. So you have to read the whole paragraph. Then only you are getting the answer. It's not like one what is that? One sentence or one after the synonymous language and all, but it is like a just based questions. Once you read the whole text, you are getting the answer.
Okay. All right. Thank you so much.
Okay. Okay, we'll go to the next question.
Yes, ma'am.
Okay, so here, second one, the purpose of the guidelines for general practitioners is. So here is a guideline and options to remind them to write asthma action plans, to raise their awareness of the value of asthma action plans, to direct their discussions with patients about asthma action plans. So here in the question, the purpose of the guidelines for general practitioners is. Okay, so we'll go to the text. Policy guidelines for general practitioners. So it is a guidelines for general practitioners regarding asthma action plans. An integral part of asthma management is the development of a written asthma action plan by the person with asthma and or their carer together with their doctor. An asthma action plan helps the person with the asthma and or their carer recognize worsening asthma and gives clear instruction on what to do in response. The process of developing a written asthma action plan is important, as this should be a discussion of the person's individual asthma and its management. The written plan is a reminder of that discussion. Written asthma action plans are one of the most effective asthma interventions available and have been shown to reduce hospital admission and emergency visits to general practice. Okay, so next slide. Next slide. Yeah, okay. So, as you see the questions, the purpose of the guidelines for general practitioners. So, what you have to look for this in the answer? What is there is a guidelines given for general practitioners. So, it is a guidelines. So, what is the purpose of this guideline? Why have they given this guidelines for the general practitioners? That's what we are going to find out. So, once you see in the answer options, you see asthma action plans, and asthma action plans. So they're talking about asthma action plans. So what is the guideline regarding this asthma action plans to the general practitioners or the GP? So what is the other thing, like the hedging words, what is there in the options are to remind. First option is to remind them to write asthma action plans. Okay. Yeah, to remind them. Them means the general practitioners, whether it is to remind them to write write asthma action plans. Next one is to raise awareness. Raise their awareness of the value. Okay, value of asthma action plans. To raise awareness. First one is to remind. Next is to raise their awareness. Next, to direct their discussions with the patients. So whether it is to remind the general practitioners or whether to raise their awareness, general practitioners, and to direct their discussions, that is general practitioners discussions with patients. So after reading this, anybody got the answer?
A.
B.
Okay, A, B, okay, good. Okay, now you see an integral part of asthma management is development of written asthma action plan by the. See, this is the topic sentence. They're talking about the asthma action plans. The integral part of asthma management is the development of written asthma action plan by, so who is writing the asthma action plan? By the person with asthma and or their carer.
Discussion.
Okay.
See, the doctor is right.
Doctors.
See,
No,
first,
by the person.
the development of written asthma action plan by, who is writing?
By the
Action plan by the person with asthma
person
and or
with
their carer. Okay, whoever. Asthma
Together with their doctor.
or the carer will be
Together with the doctor.
together along with their doctor. So
Doctor.
main the person who is writing the action care plan, it is the patient and or the carer. Understood the topic sentence? Okay. So first option is to remind them to write asthma action plan. That is the guidelines, whether the guideline is reminding the general practitioner to write the action plan. No,
No, it's already written.
because asthma action plan should be written by the patient, not the general practitioner. Understood? The first sentence?
So
Yeah.
to have
You
It is
understood the
absent.
first sentence. Just read.
Yes,
An
yes,
integral
yes.
part of asthma management. That is an integral part of the asthma management. What is the integral part? Is the development of a
Asthma
writing
written
a
plan,
return asthma
writing the
written
action
patient,
asthma
plan
not
action
GP.
by
plan
the
by the
person with
person.
asthma. So it's clear here. So who is
Yes.
writing? The person with
patient.
asthma and or
Asthma.
their carer. Okay, so they are writing. So no need to give a guideline to make like remind the general practitioner to write. Correct.
Yes,
So
yes.
not A.
Yes.
Yeah, okay. So then continue. An asthma action plan helps the person with asthma and or their carer recognize worsening asthma and gives clear instruction on what to do in response. So in the option B, to raise awareness of the value. What do you mean by value? Usefulness or the importance. What is the use of, what is the importance of asthma action plans, or what is the use of it? So the general practitioners need some
It is clear
awareness. Like
instructions.
they need to know, why is this asthma action plan written? Correct. So that is given here. An asthma action plan helps the person with asthma and or carer to recognize worsening asthma and gives clear instruction on what to do in response. Understood?
Ma'am,
So
and
that's
synonymous language. Awareness is a synonym for clear instruction and what to do in response. There is a synonymous language.
pardon,
Ma'am,
which one?
is it
Yeah, awareness means synonym is clear instruction on what to do in response. So it becomes a
Yes,
synonymous language.
yes, correct. So clear instructions on what? Awareness. No, sorry. Here, what is the use of that asthma action plan? Asthma action plan will give you, to recognize worsening asthma and gives clear instructions on what to do. That action plans will give you the clear instructions what to do in that response, because already you have written the action plan. If you have an asthma attack, what you will be doing? So that you will be writing a plan. So that will help you to note when your asthma is worsening, and then next step what you have to do. So these are the uses of writing the asthma action plan. So that useful that
ma'am, is it like paraphrasing the
recognize, see, awareness or recognize. An asthma action plan helps. Helps is what you tell it as to know the value. It will help or give it to raise their awareness of the value of asthma action plan that will help the person with the asthma or carer recognize. See, they are giving us an asthma. Why is this asthma action plan? That's what I'm telling. Value. You can see, to raise the awareness of the value of the asthma action plan. He don't know. See, for example, I can tell general practitioner doesn't know for what purpose this asthma action plan is written. So that thing is been clearly told here in the sentence. An asthma action plan helps the person with the asthma carer to, and carer to recognize worsening asthma and gives clear instruction on what to do in response. So this information is given to this general practitioner. They are getting that awareness.
okay, ma'am. Now it's clear. Yes.
Patient, they are writing plan, then the GP next to what to do, the response.
He
That is
will know what is the thing.
The
So that
GP
this
is
guidelines
getting
is giving. See, this guidelines. What is the purpose of the guidelines?
guidelines.
Guidelines means they're guidelines for general practitioners about the action asthma. Asthma action plans. They're talking about the asthma action plans, and they're giving the guidelines to the general practitioner. Why you have to write this asthma action plans? This is, you will know what is is going, what is
What
there
to
inside that
execute it.
action plan.
Response.
Yeah, they've already written what are they going through that, whether they are getting worsening asthma or next what they have to do. That information is given to the general practitioners. Okay. So next option is to direct their discussions with patients about asthma action plan. That is, it is like you are telling the general practitioner to discuss with the patient. Nothing is being given like you have to discuss with the patient and all. No, they have not given anything like discussion. The process of developing a written asthma action plan is important, as this should be a discussion of the person, individual asthma and its management. It's just talking about the asthma action plan. This is a discussion of person, individual asthma and its management. It's not telling like doctor GP should discuss with the patient about the action plan. No. What is the action plan? That is the discussion of person, individual asthma and management. They're talking about the asthma action plan. What is an asthma action plan? Nothing they're telling about. Doctor has to discuss with the patient. Understood? That is not given. That give the discussion.
Yeah,
Just
it's
is to
increase.
users.
So here it's increasing the awareness of doctor. That's all. To know the
Yeah.
value.
Yes, yes. So that is the to raise the awareness of the value of asthma action plans. Doctor should know why we are writing asthma action plan. Doctor means general practitioner. This is the purpose of guidelines. Why this guidelines is given? Guidelines is given for the GP to understand why asthma action plan is written. Clear?
So this is a topic sentence based question.
This is some
Or
No,
supporting,
I think this is
supporting
just
sentence or develop.
developing. I mean, supporting sentence. This is
Yeah, supporting
sentence.
I think this is a gist-based question because they are asking about.
Gist also, yes, is correct, because you once you read the second paragraph also you get more of the information, like what is this in the action plan. It is the discussion of person's individual asthma and its management. And written plan is a reminder of the discussion when written as are one of the most effective asthma interventions available. So all these things are there.
Okay, and the answer is in supporting sentence, not in the topic sentence, right?
Not in topic sentence.
Yeah. Thank you.
Okay. Third one. Okay. The third one, the guidelines on chemical waste disposal stress the need for staff too. The guidelines, again, this is a guidelines on what? On chemical waste disposal. And what does the guidelines do? Stress the need for something. Okay. Yeah. Stress the need for staff too. Options. Take appropriate safety precautions when handling chemicals. Ensure that any chemicals in the hospital are properly documented. C. Consult service providers before disposing of all hazardous chemicals. Okay. So what is the question? The guidelines on chemical waste disposal. There is a guideline which gives you regarding chemical waste disposal, which stress the need for staff to do something. Okay, staff has to do something. They are stressing on something, like something very important. So what the staff should do? What should they do? Whether take appropriate safety precautions.
Safety precaution.
Yeah. Then ensure that any chemicals are properly documented. Then consult service providers, whether they have to do any of these three things. Okay. So now we'll just read the text. Unknown and empty chemical waste container disposal. Unlabeled chemicals are increasingly difficult and very costly to dispose of and may require special analysis in order to identify them. Furthermore, the hospital's chemical waste contractor will now not remove any unknown chemicals due to their risk level. Every effort should therefore be made to ensure that all chemicals in use, in storage, or being prepared for disposal are fully labeled and described. If unidentified waste is discovered, you should immediately notify the hospital's designed waste contractor via the help desk and complete an incident form. All empty containers which have previously contained chemicals for licensed disposal must be considered as hazardous waste until cleaned.
B.
Anybody got the answer?
B. B.
B.
B, I think.
B.
B. All
Because
B.
it's saying about documented and describe
Hold and
details
describe.
and
Okay.
ensure.
Yes.
Ensure
Next slide.
stress.
Himani, next slide. Yeah. Okay. Next slide. Yeah. Okay. So here you have it is a guidelines on chemical waste disposal. Stress the need for staff to do something. So here we'll just see. Okay, B. Option B is ensure that any chemicals in the hospitals are properly documented. So when you come here, it is like every effort should therefore be made to ensure. So again, ensure and ensure, it is the same word. It's stressing, okay, that all chemicals in use, yes, ensure, must, that all chemicals in use in storage or being prepared for disposal are fully labeled and described. So here what they have written, ensure that any chemicals in the hospitals are properly documented. It's totally paraphrased. What is they've given? Any chemicals. In the text you can see all chemicals. So any chemicals is the same as all chemicals, correct?
Yes.
Yes.
Then
so
properly documented, it is fully labeled
properly
and described.
documented means fully labeled and described. It clearly, that sentence is the total, that sentence itself, the same sentence I've given in a paraphrased way. So you find the answer. Now, it's not only if you find the answer also, you have to try to eliminate the other two. You have to prove that both answers are wrong. So whenever you're practicing, you must do it. Okay, you have to say that the other two answers are wrong. And in during exam also, it will help you to make sure that the other answer is correct. If you are trying to prove that the other two are wrong, so you'll be like 100% correct. Okay, so first one is take appropriate safety precautions when handling chemicals. So they're not talking about any safety precautions in this paragraph. So it is not at all, it's not given. Not given.
Okay.
Yeah. Third one, consult service providers before disposing of all hazardous chemicals. So here again, you can see
Absolute.
All is absolute, yeah.
all hazardous chemicals. So absolute is there. One more thing is like consult service providers. Here you can see if unidentified waste is discovered, you should immediately notify or consult. Okay, consult or notify the hospital's designated waste contractor, that is service providers. Understood? So you are notifying the service providers when, why the help desk and complete, and when, if unidentified waste is discovered only. Correct? But here in the answer option they are telling before
all hazardous.
Only
it is only
unidentified.
unidentified only, we have to consult them or notify them. So that option is wrong. Correct?
Yes.
Yes.
Okay.
So
this
question.
This
also a gist based question.
this like you have just also, but here should is there. Modal verb, therefore is like
in crossword.
Okay.
Pardon?
And it's in the
Therefore is a contrast word.
Contrast word, ma'am.
Contrast word, yeah. Therefore.
Okay.
It's a conjunctional contrast word, yeah. Okay. We'll go to next question. This was Patricia, I think. Okay, fourth one. The memo is reminding pharmacist about. So now this is a Memo.
Memo.
So last 1, 2, we had guidelines. This fourth one is a memo. Okay, so
Memo.
they issuing a memo to the staff. What are they telling? This memo is reminding pharmacist about. They're talking about something. Okay, and it is reminding. What do you mean by reminding?
Already they know, but
It's
reminding.
already there. Yeah,
Yeah,
it's
just
already there. Again,
Yeah.
they are just reminding them to do something. Okay, so already there. So what are the options? The rationale for documenting incidents and errors, the procedure for investigating incidents and errors, the method for submitting incident and error. So now you can see incidents and errors. They're talking about some incidents and errors. Okay, so I'm sorry. This memo is reminding pharmacist that this memo is given to the making the pharmacist to do something about their reminding. What are they reminding? Whether it is a rationale for documenting. Why do you want to document the incidents and errors? Okay, whether they're talking about that, or procedure for investigating incidents and errors. How we are going to investigate incident and errors, a procedure, whether they are reminding about them. Or third one, method for submitting incident and error reports. How we are going to submit the incident and error reports. Okay, understood the options?
yes.
Yes, ma'am.
Yes, documenting.
Okay, so we'll go to the text.
Rational
Yeah.
procedure.
So memo to all staff regarding pharmacy incidents and errors. So dispensing errors, other significant errors, omissions, incidents or other non-compliances, including complaints of a non-commercial nature arising both within and external to the pharmacy, may be the subject of investigation. So may, okay. Pharmacists should therefore follow a risk management procedure, including appropriate record keeping. The record is to show when the incident was recorded, when it occurred, who was involved, both actual and alleged, the nature of the incident or complaint, what actions were taken, and any conclusions. If contact was made with the third parties such as government departments, prescribers, lawyers, or professional indemnity insurance companies, details of the conversation should be recorded. Regardless of how serious the incident may appear, comprehensive, detailed records need to be kept. The record should be kept for 3 years because of the delayed nature of some forms of litigation. Okay?
B. No, sorry, A.
A, I think.
A. Yeah.
A.
They
Okay.
are about document. It is continuously document is repeating the word.
Yeah.
Okay.
Document only.
Yeah, it's correct. So next slide. Yeah, next slide. Next slide. Yeah, yes. So here you can see this is about a memo and reminding the pharmacist about. So as you all told, it's just they're reminding it because it's already there. So what are they reminding? The rationale for documenting incidents and errors. Why we should document? Why we should write? Rationale means reason. For what reason we are documenting, or the pharmacist should document the incidents and errors. Next one was the procedure for investigating. How to investigate an incident and errors. They have not given anything here, right? So the first question, the first option, you can find the answer in the topic sentence itself, like dispensing errors, other errors, omissions, incidents, and all those things, complaints arising both within the external to pharmacy, may be subject to the investigations. Okay, it's like a something. What do you tell? It can you will have a subject. There will be an investigation. So, pharmacy should therefore, hence, it's like cause. What do you like? Solution, problem, and solution. The problem is that it can come. It can come. Maybe the subject of investigation. So what the pharmacist should do? Therefore, follow a risk management procedure, including appropriate record keeping. So record keeping is nothing but documenting. And again, they are just supporting sentence. The record is to show when the incident was recorded, like what is included in that records. what should be their actions taken and all those things. And if anything is like any other third party is inputted, even that conversation also should be recorded. Mainly it's just recording so that is what documents.
Yeah.
Okay. And at last, again, they're telling the record should be kept for 3 years because, again, it's the form of litigation. So in the topic sentence itself, you find the answer like it can be subject of the investigation. Hence, the pharmacist should follow a risk management procedure, including appropriate record keeping. So record keeping is documenting. Okay. And other two options, procedure for investigating the incidents, how we are going to investigate the incidents, it's not given. The method for submitting incidents and error reports, how we are going to submit this report. They just told you have to keep the record, not to submit. They're not talking anything about submitting the records. So both are not given in the text. Okay. So some of these type of questions, like once you read the first topic sentence itself, you get the answer. And you have this modal verbs like may, should, and contrast, therefore, as a result. It's like a result and effect. Okay, because of the subject of investigations, you have to have this appropriate record keeping. So that is also one based questions. Understood?
Yes.
Then pharmacist.
Yes,
Yeah, the pharmacist what to do? That correct. The pharmacist name. It's
Yes,
is
yes.
giving
Pharmacist,
After
health
may.
care. Yes. That is also one of the main
That's the
heading words that
doubt-based
you find
question.
in
Yeah.
and answer. You get the same word, pharmacist and pharmacist. Correct. Okay, we can go to next question.
Yes, sister.
Okay, so fifth one. Yeah. So what point is being made in this guideline? Again, you have this guideline about patients with multi-trauma. So if the patient is having a multi-trauma, what point? Something is they're telling about one particular point being made in this guideline. Okay, so options. Staff should make it a priority to rule out spinal injuries. First option is staff should. Should is a modal verb. Make it priority. That is a main first thing. To rule out spinal injuries. Rule out means whether
Find
spinal
out.
injury is there or not.
Yeah.
Yes, find
To
out.
know.
Yeah.
Find out.
No, to find out. Yeah.
Rule out means it's not there. Spinal injuries is not there. Okay. Don't confuse. Rule out means not there. You don't have spinal injury. The patient
To
doesn't
make
have spinal
sure.
injury. That is called rule out.
So patient have not spinal injury, right?
Rule out spinal injury means the patient is not having spinal. If patient is coming from with the polytrauma, you have to first see that patient is not having spinal injury. Okay, understood? That is
Right.
that is the of rule out.
Yeah.
Okay. Next, B is spinal injuries are missed in small but growing number of cases. Some spinal injuries are missed in small number of growing cases. Okay. Then there is evidence that immobilizing a patient with spinal injuries is helpful. So there, what is the point is being made in this guideline about the patients? You're talking about the patients. Okay. So whether staff should make it a priority to rule out spinal injuries. Spinal injuries are missed in small but growing number of cases. There is evidence that immobilizing a patient with spinal injuries is helpful. Okay. I will go on to the text. Evaluation of potential spinal injuries. Amongst adult patients suffering high energy multi-trauma, approximately 5% will suffer a significant vertebral column injury. See, I'm just leaving that thing in the bracket. Okay, that's like subject complement. You can just leave it.
Yeah.
Vertebral column injury, and significantly less than 1% suffer a spinal injury. The main risk from undiagnosed unstable VCI is that further neurological compromise will occur. Balanced against this rare but contrast word, potentially catastrophic risk is the fact that majority of the trauma patients do not have a VCI, and prolonged application of spinal precautions and immobilization is associated with multiple complications, including pressure source raised intracranial pressure or ventilator associated pneumonia. Furthermore, The efficacy of these interventions in reducing secondary neurological compromise is controversial. Therefore, you have the contrast word. I mean, conditional. Okay, contrast word. Therefore, patients in ICU should undergo spinal evaluation by CT imaging and interpretation by a consultant radiologist within 24 hours of injury. If imaging is undertaken out of hours, it is acceptable to continue spinal precautions overnight and review imaging early the next day. Okay. Next slide. Next slide, please. So, words, hedging words in the question we have marked as what point is being made in the guideline about the patient with multi-trauma. Okay, so the multi-trauma, if the patient is coming, what point is being stressed? So in the answer, marked staff should make it a priority to rule out spinal injuries. Priority to rule out. Then spinal injuries are missed in a small but growing number of cases. There is evidence that immobilizing a patient with spinal injuries is helpful.
Yeah.
Yes.
Okay.
So it's an inference type question. Inference. The conclusion.
Conclusion. Yes. It is like, yeah, we have done all these things. Therefore, so these things can happen. So first thing is like what you have learned from starting, the patient suffering with high energy multi-trauma, they may have spinal injury. And next you have in the sentence, you have prolonged application of spinal precaution and immobilization. You will have complications including pressure sores if the patient is having spinal cord. So what next? So therefore, what you have to do? Conclusion. What you told was correct. Conclusion.
First we have spinal injury or no,
should
we have to
undergo
find.
spinal evaluation by CT imaging and interpretation by consultant radiologist within 24 hours of injury. So staff should make it a priority immediately. So within 24 hours, it is a priority to rule out spinal injury. That is, you make sure that patient doesn't have spinal injury because they've already because they have told prolonged application of spinal precaution and immobilization will lead to complications. So if you don't have any spinal injury, there is no need to give any immobilization, right? So you can avoid all these complications.
Yeah.
So as you told, it is a conclusion. Therefore, so once you read all this, therefore, this is not near. First, you have to the first thing you have to do is you have to rule out. Yeah, if no spinal injury, then no need to do all these things. Okay, so these are the complications if you are doing unnecessary things. So second option was spinal injuries are missed in small, but that's not given in growing number of cases. Some comparison of cases, number of cases, nothing like that. It's increasing or something like that. There is no comparisons. Correct? So it's not given in the text. Next, the option is there is evidence that immobilizing a patient with spinal injuries is helpful. In the option they're telling if you are immobilizing the patient with spinal injury is helpful. But in the text, what have they given?
Priority should need to rule out.
It will be the
Immobilization with multiple complications.
Yes. Prolonged application of spinal precaution and immobilization is associated with multiple complications, including pressure sores, raised intracranial pressure. All these problems are there. But it's automatic. It is like opposite they've given. Correct. It is they are telling immobilization is helpful, but in the text they are telling there are so much of complications. So that is opposite. So obviously you got the answer A as correct answer. So always try to tell that the other two answers are wrong. Then only you will be like 100% correct. So that you make it a practice, like I mean, it has to be done when you are practicing and you try to do it for your exam also. That will give you confidence. Yeah, that answer is correct. I'm 100% sure. Okay. Then still we'll move on to the last question.
Ma'am, excuse me, I have confusion in this one.
Yes, tell me.
The last C option, there is evidence that immobilizing a patient injury is helpful. So actually, isn't it helpful if you have spinal injury, you should not move the patient, right? According to medical
Yes,
knowledge.
ma'am.
According to
Medical knowledge, but in the text,
yeah, now we are answering only based on this paragraph.
text.
What is a text?
Okay, ma'am.
Okay, we know so many things. I know that. We know so many things, but don't get confused with all those things. You have to just focus on the text. From the text, you have to pick the answer. Okay?
Okay, ma'am. And one more
Don't get
confusion,
confused.
is this guidelines to the staff or is it about to the patient?
About
This is for
patient.
the staff.
No, guidelines to the staff only. Coming with multi-trauma, you're giving the guidelines to the staff. Guidelines is always to a healthcare professional.
Okay, ma'am.
About the patient.
Yeah, about the patient. About the patient with multi-trauma.
Multi-trauma.
Okay. Okay, ma'am. Thank you.
Okay. Can we move on to the next one?
So the guidelines mean to giving instruction to the staff, right?
Yes, yes. You have to do like this. This is the way you have to do. That is the guideline. Okay. Now, can I move on to the next question?
Yes,
ma'am.
please. Yeah.
Yes.
Okay. So last sixth question. What does this update? So there is something update. Tell medical professionals. So again, here also update. Something newly they have updated. Okay. It was already there. What does this update tell medical professionals about
bovine,
yeah,
Bovine incident.
about bovine
bovine
incident.
incident.
About bovine incident. So something they're telling about this bovine incident to the medical professionals.
Professionals.
It's about question.
So yeah. So option A is it is being withdrawn due to risk.
Associated with
Excuse me.
Associated with this
Due
long-term
to risk.
use.
Next, option B, users may experience difficulties when switching to alternatives. Then C, any side effects are more difficult to identify in older patients. Okay, clear with the options? It is being withdrawn due to the risk.
Yes.
Some risk is there for bovine insulin, that's why they are withdrawing. Okay, associated with long-term use. Next, users may experience difficulties when switching to alternatives. If other than bovine insulin alternative, when you're switching on to other alternatives. Then option C, any side effects are more difficult to identify in older patients. Okay, it's difficult to identify any side effects in older. These are the options. Now we'll move on to the text. It is a memo to all staff regarding bovine insulin.
Withdrawal of bovine insulin.
They're talking about withdrawal of bovine insulin. They're going to stop the bovine insulin. Okay. So what will happen? Bovine insulin preparations will shortly be withdrawn due to limited availability of the active ingredient. So here in the first option, what have they given?
Long-term
Due
use.
to the
Withdrawn due to risk associated with long-term use.
long-term use.
Withdraw due to limited availability.
Just because limited availability, nothing like risk or something like that. So answer option is wrong. Correct. So A is gone. Okay. Now, as people with insulin treated diabetes who currently use bovine insulin preparations will continue to require insulin treatment, they will need to be changed to alternative acceptable preparations. So though bovine insulin is stopped, patients will need insulin because they are still diabetic, right? So what is the next? They have to move on to some other alternative preparation or acceptable preparations. Next, people using bovine insulins are likely to be older patients with long-standing diabetes. They may therefore have absolute insulin deficiency. These individuals will be at risk of impaired awareness of hypoglycemia, predisposing them to severe hypoglycemia. Again,
Any
use
side
of bovine
effects?
insulin has been associated with presence of insulin autoantibodies, which may impair the action of insulin. Porcine, human, or analog insulins are likely to lower the glucose more than the same dose of bovine insulins, and insulin dose titration may be difficult and unpredictable. People with bovine insulin-treated diabetes are therefore a high-risk group. Okay, so first option A we have eliminated. Next two options are there.
See,
See,
any
may-
side effects? Side effects?
be switching to alternative. They will need to be changed to alternatives.
It is high risk for old age people. They said like that.
No, they didn't say anything to identify.
Users may experience older people.
B, ma'am. Users may experience.
B, ma'am. The second line itself will be changed to acceptable preparation. Switching to alternatives.
Yeah, users may experience. Users, who are the users? People using bovine insulins. I stressed there, right? So those are the users, people using. What will happen? Likely to be, there are also older peoples. Older people are there. Okay.
There.
Likely to be older people with long-standing diabetes. They have long-standing diabetes. They may therefore, so most of these people are older people, and therefore they have absolute insulin deficiency. Okay, if they are not giving any insulin injection. And these individuals will be at risk of impaired awareness of hypoglycemia because they are older patients. They don't have any awareness of this hypoglycemia. Correct. And predisposing them to severe hypoglycemia. So as the patient doesn't know about the hypoglycemia, they are going into hypoglycemia, into severe hypoglycemia. That is one thing. One more is that it is use of bovine insulin has been associated with the presence of insulin and autoantibodies. So there is already insulin autoantibodies which may impair the action of insulin. Okay, then next one more point. Porcine, human or analog insulins are likely to lower the glucose more than the same dose of bovine insulin. That means, see, if you are giving human insulin 1 unit, maybe I'm just giving an example, some mg of maybe 10 mg, I mean 10 of glucose, I mean 1 unit of insulin you are giving and 10 mg of glucose is lowered. For example, I'm telling, but more than the same dose of bovine insulin. So analog insulins are likely to lower the glucose more. That means if bovine insulins you are giving 1 unit, it will reduce only 5 mg. Whereas if you are giving human insulins or analog insulins, it will decrease 10 mg of the glucose. I'm just telling and to understand. Okay. So what happens if you give? Now you have to change the titrations. Correct. For patients, you will be giving till today, you were giving some 12 units of insulin, bovine insulins. You can't give the same 12 units when you are changing it to the human or analog insulins. Again, the titration is a very difficult and unpredictable. You have to again, after so many days only, you will again come to the correct point of, or you will find which is correct unit to be given to the particular patient. Okay. Understood? So these are the difficulties. So here in the option, you can see users. Who are the users? It is like almost like a gist-based question. The half paragraph, the whole thing. Once you read only, you get the answer. And you can see users may experience difficulties. It's not one difficulty. You have so many difficulties.
Yes.
Okay. When switching to alternatives, here to here, when they're switching from bovine to other alternative, they have so much of problems. What are the problems? One is the older, most of them are older patients, and they are not aware of the hypoglycemia. Hence, the patient will go to hypoglycemic level. One more is the bovine insulin is associated with autoantibodies, which may impair the action of normal insulin. Okay. One more is the titration, like the insulin level, the same dose difference is there, as hence this titration and is very difficult and unpredictable. So these are some 2-3 difficulties or problems they have listed. So that plural and plural answer, that is also one of the way you get the answer. So users may experience difficulties when switching to the alternatives. When you're changing the medications, you have so much of difficulties. So that is the answer. Option C is the answer. I mean, sorry, B is the answer.
So how can we option C?
First,
how can we?
Yeah, coming to option C. Oh my God, 1 minute. Excuse me. Yeah. Any side effects are more difficult to identify in older patients. It is a comparison, comparing some two things, right? It is more difficult to identify in older patients, or it's very easy to identify in younger patients. Is it given in the text? Any comparison being given?
No.
So it's not there.
And they didn't mention any side effects.
Yes. Side effects. Yeah. After taking the bovine medicine, whether the patient is having side effect? No, they have not given.
But, yeah. So that's why it is eliminated, right?
So I think now I've completed. I think not at least 100%. I think some 50% I've made understand to, or I mean, I've explained the questions.
Very well. You explained.
No, it is really useful, ma'am, because once we are discussing,
yes,
and we can learn also.
Okay. So one more thing, like my suggestion, please watch father's videos and take notes and understand. He is the best. Like he has explained each and every questions as much in a maximum possible level. So you keep on listening. If you don't understand again and again, you just listen to his videos and you will understand. Then you will like practice, and you have to consistently practice with that. Then you will be like, you will feel like, yeah, this is OET is, that's all. You can do it, and everyone can do it. You will crack OET, and as father told, always be smiling and be happy while practicing. Be thankful, pray to God. God will always be there with us to help. Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you so much.
Thank you, ma'am.
Welcome.
Linny, thank you so much for such a wonderful section you have taken. It's very useful for the newcomers. Thank you.
Thank you. Welcome.
Thank you, sister.
Thank you.
Thank you.
Is there any task for today, and there will be any session for tomorrow?
Malik, didn't get what is that?
Yeah, you are. Hi, Manju. Oh, sorry, hi, Mini. How are you?
What did you ask? I'm
I
fine.
asked, is there any task for today, or is there any session from tomorrow?
Task already, Shanmugam is sharing, yes.
Okay.
Did you get the task today?
No, actually, I am not taking the Zoom session because I'm working, and you know that I'm in a UK, and because of the timing difference, I won't be able to attend the session. But I am watching all the sessions in the evening, and I am sharing my learning to the main platform. But from next week, the kids there is a kids holiday, so kids will be at home. So hopefully, I will attend the live Zoom session from next week till September. So that's why I'm just wondering, is there any tasks for today?
Yeah, that the Shanmugam will share that.
All right. Okay. Lovely. All right. Thank you so much, Mini. Thank you.
Thank you, ma'am. Thank you all. Thank you, ma'am.
Can we leave now? Thank you so much.
Himani,
Yes, there is nothing to discuss, right?
yeah, just make a father to host back, okay?
Yeah, I'm father is the host. I'm co-host.
Then okay. Excuse me, sir. Manju ma'am.
How many? Father is mute still. Mini, if once I will call father, if
Yeah.
I'm out, then just again you have to join me again.
Ah, okay. Please wait, okay, until we wind up.
Mini, father is not picking the call. Maybe
Yeah.
father is busy, then we can leave. Mini, what about the YouTube recording section?
No, YouTube section live only father can off.
Okay, then fine.
Recording
Father is not,
to the father.
not picking the call.
I already father told me that father is busy with some other sections. After that, just re back to the host. Then, but just wait a minute.
Okay, then we can wind up. Okay, you people can leave.
Just tell
Thank
them
you.
this live
Thank you, ma'am.
in between, and until we wind up, just they have to stay here because maybe in between father will come.
Okay, they have to stay back.
No, not now. In between they have gone because around 30 members were there, and now only 23 is there.
Okay, fine.
Permission they have gone, but father will come last minute there. Then what is the use for that? Okay, ma'am, we can wind up. At least
Okay.
to do the respect for the father.
Okay. Thank you, sister. Okay,
Thank
Manju
you,
ma'am.
ma'am.
Okay. Okay, bye.
Okay. And okay. Thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.
Mhm.
Thank you.
You can leave.
Himani, is that Himani?
I will, yeah, you're going to leave.
Okay. Manju ma'am, leave ചെയ്യാമോ?